everyone. Thank you so much for joining me for another episode of my COVID recovery series where I speak with people from around the world who have recovered from the coronavirus and can share their inspiring stories of recovery, resilience, and hope. And also people, again, from around the world, movers and shakers who are fighting the good fight against this pandemic. This morning, I am really excited to go to California. It's morning time in California and evening here in Europe, but I'm really thrilled to go back to my home state and speak with an athlete who himself contracted the virus, but is now well and is also now giving back to his community. It is my pleasure to introduce you to Jason Collins, an American former professional basketball player who played 13 seasons in the NBA. He was also in 2014 named by Times Magazine as one of the 100 most influential people in the world. There's also an annual Jason Collins Award that is named after Jason, that is given to people who strive for inclusivity, something that we are going to talk about. The award is going to people who effort to create a safe community and an all-inclusive community for LGBTQ in K-12 schools. So that's something we're also going to touch on. Jason is an inspiration to many young athletes and people around the world and is also known for his kindness by many of his friends and followers, including Chelsea Clinton. Let's see if Jason is here. We will be adding Jason in. There we go. Hi, Jason.
Hi.
Hello. Good
How are you
morning.
doing? Good morning. How are you doing?
Good, good. It's so good to see you from sunny California.
Well, it's not so sunny today. We have overcast and it was raining earlier.
Oh my goodness. The
Yeah,
maybe
but the
one
past
time it rains in California.
exactly. It's this is the first time in a couple weeks. So we need we need as
Of
much
course.
water as we can get. So we'll take it.
Of course. Well, it's quite overcast and cloudy here in Stockholm, and I'm still wearing my sweaters. By the way, people who watch my interviews, they're like, Tara, why are you wearing sweaters? Where are you that it's so cold still? So it's super cold in Stockholm. It was snowing. So I certainly envy you
Wow.
now being in Cali. Well, thanks so much for joining the program, Jason.
Yeah, and if I seem that I'm going rocking side to side, it's because I'm on my Peloton right now. I'm,
Oh my goodness. Well, good.
yeah,
Um,
getting
Staying
getting a
active,
light
of
workout
course.
in.
Well, how are you doing? Let's talk about that. You contracted the virus when you
Mhm.
were in New York, and I want to ask you why you were in New York because it was for a good cause,
Yes,
and
yeah.
and you got the virus from there. So walk us through.
Sure. So I yeah, contracted the virus, I believe, when I was in New York. I was in traveled to New York in the beginning of March for the Brooklyn Nets Pride Night game. So there were I left on March 2nd and then returned to Los Angeles on March 5th. The game was on March 4th, the Brooklyn Nets versus the Memphis Grizzlies. It was their Pride Night game presented an award, which I think you were just talking about, the Jason Collins Award. It's kind of crazy to have an award named after me, but presented the award. And then the day before, I did a panel where I spoke at the Nets practice facility. And it was interesting because I saw a couple of people in the practice facility who had colds, the usual, you know, cough and
Yeah.
sort of, you see it and you're like, oh, they have a cold because this was still, we're about a week away before everything
Right,
sort of hit the
right.
fan. But you try to do like the elbow dap to people or try to keep your
And it
distance,
still
but
was a
at the same
joke.
time,
People were not taking it seriously.
yeah, well, again, I think Americans at that point really didn't understand that it was, so prevalent and that it was
Mhm.
in our community spreading around so much and that it that common cold that you see people have, and and still go to work kind of thing,
Right,
and try to work through, like, that's that might not have been a common cold kind of thing. So I got back to Los Angeles on, I believe it was Thursday, the 5th, and again I was feeling completely fine, and it didn't hit me until the next Wednesday, March 11th. That evening, late at night, that's when I had my first symptom. And earlier that night, I had played doubles. I had played mixed doubles. I had played tennis. I live about 2 minutes from some tennis courts. And again, I had no idea that I was, I guess the term is pre-symptomatic at that point. So yeah, it was such a strange illness.
And you and your partner both got it, and you guys got sick together. You went through it as a team.
Yeah, I went through it as a team, and unfortunately, I was the one who got him sick. But yeah, and we both had the symptoms on the same night on Wednesday, March 11th, and it started with a really bad headache.
Now, you got tested, and testing has been something that I've been talking to a lot of people, whether it be Europe, Middle East, and the US. But that was okay for you guys. In Los Angeles, you went to your healthcare provider and they tested you and you got the results.
Yeah, so the symptoms, so the first symptoms started on March 11th. About a week later or 6 days later is when I had the fever. And then when I started connecting the dots between the fever, the headache, loss of smell and taste, and dry cough, like start going down the list of all the symptoms. I started talking to my doctor, just like this, over FaceTime or telehealth. And I mentioned to him that I want to come into the office to get tested, and he said, "Well, you can come in," and this is on Wednesday. This is around the following Wednesday, about a week later. And he said, well, you can come in on Monday, and because that's the day that we're doing all the tests. Like, there are special protocols for coming into the office. They have to clear the hallway. They have to do all this stuff. So that was supposed to happen on Monday, but I didn't make it to Monday because I ended up going to the hospital on Saturday morning. My chest, so about day 10 into it, my chest got so tight, and I was worrying that I was having a heart attack. I've never felt, that feeling, and my heart, it was doing all kinds of crazy stuff. So I called my doctor's office, and they recommended that I go to the ER. And it's all UCLA Health Network. Okay. So when I was at the ER, that's when I got tested, because they said, well, there's no reason for you to go on Monday since you're already here. Let's just test you right now. And the way that UCLA Health is, everything is through an app. So I got my test results about 24 hours later. So it was very quick. I know that some people in the past, I think obviously now that it's a little bit quicker with the turnaround time, but for me, being 24 hours, it was pretty quick. And yeah, and my partner didn't want to get tested because if I had it, then he definitely had it.
Of course. So, same with me. My partner had it, he got tested, and obviously I had it too. So our stories are so similar.
Yes, So, but yeah, day 10 through like day 9, evening day 9, but definitely day 10 through 13 were the toughest. And that's another thing that's so tricky about this, is that usually we're used to like a flu lasting maybe a week, right? The longest. But this thing really for us was at least a 2-week, 2.5-week process.
And I think right now there's a conversation about how long this really stays in your body. And I don't think there's an accurate answer. We don't know exactly for how long the virus stays in your body. Comparing to your friends or acquaintances or people that even in New York, do you think you had an easier access to healthcare, or getting the support that you needed in Los Angeles? Because in New York, of course, it's the epicenter of the pandemic. People are continuing to have a hard time. But how do you compare your care with, let's say, others or people you know of, or even in the news, how do you assess the situation?
I was very fortunate in that I've been going to the same healthcare provider, the same system for, gosh, over 15 years. So I have a relationship with, or I've developed a relationship with some of the nurses and some of the front office staff in the practice that I go to the point where I have a cell phone number of one of them. So when I first started having symptoms, I texted her and just like, heads up, I don't know, if it is COVID, but I'm having these symptoms kind of thing. So I know that I was very fortunate that I've, developed relations. I've been going to the same healthcare provider for so long, developed these relationships where I actually have cell phone numbers of my healthcare providers. And when it was bad, those days that I was talking about, day 10 through 13, my doctor set up a call schedule for me, especially day 12, 13, 14, where he would call 3 times a day. And I know that's, I'm very fortunate. I had excellent health care, and they were checking in on us routinely, to the point where I had to actually tell my doctor, like, you have other patients, like,
yeah, it's okay.
On day 14, let's just check in the morning, and then if I need you, I'll call you. But I'm so thankful to my doctor for that constant level of care and concern. And that's something that I know that not everybody has access to. But it's something that everyone should have, at a bare minimum, be able to easily contact their healthcare provider and have a relationship with a medical professional, a healthcare provider, to answer questions. Something that really helped me was when my doctor suggested that I get a pulse oximeter, and then we were able to have one delivered here to the house. That's something I know that not a lot of people can do. But it really helped me to calm my fears when I put that little clip on your finger to measure the oxygen in your blood and see that my oxygen level was still very high. So that sort of just made me as much, de-stressing as possible.
Exactly. It's funny because you mentioned that, and that's something that I've been looking for in Stockholm, because in the first 2 days I wanted to use it for my partner, but I couldn't find it in any pharmacy or anywhere. I want to talk to you about, there's so many things I want to talk to you about, but I guess first let's tackle the sort of mental health and emotional aspects of this. We're all human, as strong and resilient as some of us are. There's still so many unknowns that go around with regards to this. And we had this conversation. When I got sick, I was really interested in, hearing hopeful stories, getting some good news. We both got sick at the same time, and I think right now there's so much information out there. But I think for you, as someone who dealt with this, what kept you going, Jason? What gave you that hope, and what kind of took away from your anxiety?
Well, it definitely wasn't watching the White House press briefings. That was a nightmare to watch. That was giving me anxiety and stress.
It still does.
Yeah, it's still like it's a nightmare. So anyways, the thing that gave me hope when I was looking were stories of people who had, a tough time of it. Because everybody, in the beginning they were talking about, you can have these mild, and I guess technically it would be considered mild what we went through, but it didn't feel like anything mild because it was definitely the sickest that I've ever been in my life. But I was looking for stories of hope. So I turned to Tom Hanks and his wife, Rita. They were, because that same day that same night that I had my first symptom, that was when it was announced that Tom and his wife had tested positive down in Australia, and that they were battling it. So I was sort of keeping an eye on them. And when I saw Rita post the lip sync to Naughty by Nature song, and it's like, oh, she's feeling a lot better now. So that's good.
There's hope. I can get better too.
Yes, there's hope. Yes. So, and I was constantly looking, because when you're battling COVID, you want to obviously gravitate towards hope and like, okay, I'm going to be like that person who has recovered. So yeah, they were my inspiration. So if I ever get to meet them, I will give them, well, I don't know if we can give big hugs, but I'll do like a big air hug kind of thing.
Big air hug.
Big air hug and say thank you so much, because they really were just hope and someone who was going through it. And then also my family, obviously. I relied heavily on my support system, going through it with my partner, but also FaceTiming with my brother and his wife and kids, my parents, my aunts and uncles and everybody. Just reaching out. And then also when I got the test results back, I let a few of my friends know. And I wasn't sure if I was going to come out publicly about it, because obviously anything about your private health is yours to, whether to share or to not. And I didn't know if I wanted to share publicly that I, tested positive. So getting, hearing from my friends who I did tell, that, hey, this is, and then, sort of I reached a decision a couple of days later. Okay, I'm just going to rip the Band-Aid off and tell everybody that, hey, I've tested positive, kind of thing. And seeing the response on social media from people reaching out, wishing all the well wishes, that definitely lifted my spirits as well.
Good, that's good. I think in times of crisis, whatever it is, we also look for leadership, and that's something that we talked about. I'm in Sweden right now. Their policy is very different than elsewhere in the world. In the UK, where I live right now, that has been quite, crazy as well. In the United States, of course, we are all seeing what's unfolding. You live in California, so, the governor's policies are quite different than what comes from the White House. Talk to me about that leadership. What do you want to see? What should we see? And what are your thoughts?
That was impressive and inspiring to see, was the way that in the absence of leadership from the White House, the way that governors stepped forward and mayors. We had London Breed, the mayor of San Francisco, was the first mayor to really enforce stay-at-home orders in the country. And then also our mayor, Eric Garcetti, followed suit. And then our governor, Gavin Newsom, has then, we have the West Coast Alliance with Oregon and Nevada and Washington. And then you see the Northeast Alliance with New York and Connecticut, Pennsylvania. It's sad that the federal government has sort of thrown their hands up at this. But it's also inspiring in that vacuum to see people like Gavin Newsom step forward, and the Governor Cuomo from New York has been excellent, just incredible. Obviously we're seeing that more and more parts of our country are starting to open. It's frightening. I saw a video I think it was from Scottsdale, Arizona. It was a bar, restaurant, and you just had people no mask. Just, it looked like something out of spring break, 5 years ago kind of thing, where it was, brunch as usual. Yeah, and that is, I can't imagine the level of ignorance and stupidity that is. If you're going to open, you have to open safely. You have to be able to maintain physical distancing. Everybody has to have a mask on. I wear glasses. You have to protect yourself, because this thing might not harm you, but it can harm somebody else, and not just harm, but kill. This is obviously a very deadly virus, and we're almost to 100,000 dead here in the United States, and it's frightening.
A lot of people look up to you, especially young athletes, a lot of boys, a lot of people from different backgrounds. I think some of them, who ignore the virus, they think that, we're not going to get sick, or we're strong, or, we're athletic. I think as an athlete and, a strong person, what do you say to them? What do you say to those young kids who think they're strong and, you know, they're macho and they're gonna, you know, beat this? Because I bet they would listen, you know, to someone like you.
I would say it's not about you. It's about the community. It's about your grandparents, your parents, your little siblings. Try to step out of your own shoes and see it from a bigger picture, a bigger perspective of trying to contain this deadly virus. And look, there are stories of young people dying. I just saw a story about a 29-year-old young man who died in Puerto Rico. Gosh, just you got to protect yourself. And again, there are ways to, if you want to, you know, be out there, to protect yourself and to protect your community. And just please wear masks, please keep distance, wash your hands, and also again with eyewear, wear some sunglasses or regular glasses, and just be smart. If you have to go out, be smart about it.
You know, the show is about hope, and, you know, I always want to keep it on an inspiring note, but we can't, you know, ignore the facts. We also can't ignore reality, and that's something that I want to talk to you about, Jason. Let's talk about the African American community. Unfortunately, they have been hit the hardest, and more than 70% of the regions hit were, you know, of African American communities, and you know, I want to talk to you about your thoughts on that, but also why do you think that is, and also, and lastly, what can the community do in these regions? What can, you know, Americans do at this time as we're coming out of the lockdown to help the communities worst hit?
So, the African American community, along with other communities of color, have a lot of pre-existing conditions, such as high blood pressure, diabetes, obesity. The list goes on and on and on. A lot of that is because of a lack of access to good health care. As we're opening up, the one thing that I want to stress to the African American, and also to any, this goes across the board, is when you're going to large gatherings. I think in times of hardship, my community, my family has always turned to the church.
Right.
And that coming together in large groups like that can be troublesome. So there are ways. I mean, my dad now, he's been, you know, goes to church every Sunday, but now it's like this. It's digital. There's ways to still get the word, to feel like you're connected to our you know, community, but to do it safely. And I think more and more churches now are going with the ability to stream their service. And I think that if you fall into a high-risk category, that would be an excellent way to avoid large gatherings, but yet still feel connected.
I see. I want to talk about disparity. You mentioned, you know, the healthcare issues that the African Americans face, and, you know, other communities of color and ethnic minorities. What do you think policymakers can take away from this? You know, let's say a year from now, looking at the data and the numbers that we have, what can policymakers, both at a federal level and local levels, do, knowing, you know, what we saw?
Well, we see even now that parts of the Trump administration, even now, are trying to kick people off of Obamacare, trying to take away people's health care, which is just, gosh, just infuriating. And
you wonder what's going on.
Yeah, in the middle of a pandemic, you want to take away people's health care. Just absolutely nonsense. But so once Joe Biden gets elected as our next president, we need to make sure that he has policies to expand healthcare to as many Americans as absolutely possible. I believe now without the healthcare service that I received, I might be dead. So I don't want anybody else to feel like they might die because they have poor healthcare. I believe in universal healthcare now, and I hope that once President Biden gets into office, that we can find a way to expand healthcare to as many people as possible. And it should be independent of your job, because obviously now we see a lot of jobs being lost, which means a lot of healthcare coverage is being lost. So there's got to be a way that we're going to have to look ourselves at our country in the mirror and say, how can we expand healthcare, and how can we do it independent of whether somebody has a job or not?
Do you think President Obama, or former President, President Obama's speech over the last couple of days was inspiring?
Brilliant.
What did you think of that?
Brilliant.
Was it needed?
Absolutely brilliant. It was beautiful to see, inspiring to see, incredible, all the adjectives you can imagine. Just to see, that's what true leadership looks like. Someone who can put together coherent sentences and leave you with a smile and like feeling like, okay, this is, and that line in there about do what's right, not what feels good, because that's what kids do, and some adults who are acting like it. But that line, that reminds me of something that my grandmother, my great-grandmother, the older folks in my family would say, just to teach accountability to someone and to teach responsibility. And so it is very cool to see the words that President Obama said. And he didn't even name, names. But we all know the tone and the character, and it's also another sad thing to see how, because of Trump, like this negative part of our country it feels empowered and inspired. And you see in Michigan, people open carrying, assault rifles into the state capitol, and they had to, cancel a session of their state legislature because they're of a safety issue. And it's sad to see, and I hope that once President Biden gets elected, that we speak to that part of our country and say, grow up, and let's do the right thing for all of us.
We're talking about inspiration. Let's talk about the Jason Collins Award. I don't think I did justice trying to explain.
No, it's kind of weird to hear it. Yeah.
Talk to me about it. Actually, I think a lot of people would be inspired by that. And don't be modest. Tell us about it. What's the cause?
So I'm extremely honored that the Brooklyn Nets decided to name an award after me. They at their Pride Night game, and that's something else that I love to see is folks in the sports world embracing the LGBTQ community. Usually, nowadays it's through Pride Night games or something along those lines, where they host panels, really inviting and celebrating the LGBTQ community to participate, to be their true authentic self. Our fans, our employees, and members of the team.
Right.
So yeah, each year the Brooklyn Nets find someone who has exemplified courage in the community with regards to standing up, whether it's being a member of the LGBTQ community or being an ally of the LGBTQ community. Again, going back to what President Obama said, doing the right thing. So folks who are doing the right thing.
But specifically K-12 in that community, in the early.
It depends, but it is, yes, we're definitely looking to foster and encourage the next generation. But it runs a gamut of anyone in the New York area. A couple years ago, the award was presented to the owners of the Stonewall Inn, which is obviously a national landmark. And also a couple years ago, was presented to Eliza Bayard, the head of GLISTEN, which is an organization that creates safe spaces in schools for LGBTQ kids. So yeah, it runs the gamut. But folks who are doing good work and doing the right thing.
Speaking about fostering the next generation, I mean, you have moved the needle, Jason, on many fronts, you know, personally, athletically, professionally. A lot of people look up to you on many fronts. How do you want younger kids, you know, the young generation of future American leaders to move the needle? What are the values you want to see in these kids?
I want them to respect each other. I want them to, you know, when someone shows you who they are as far as being a good person, as far as being authentic, and being a decent human being, we should encourage that and say, this is, you know, just be you. And you know, spreading that message of love and acceptance and equality. It's not just for LGBTQ, but it crosses, you know, whether it's gender, race, religion, socioeconomic, you know, it runs the gamut. But just, you know, love, you know, your fellow human being. But then also, if someone is doing something wrong, to be an ally, to speak up. I know that some folks, when they think that a certain group isn't in the room, that they can start speaking out of turn and start saying something that language that's, you know, unacceptable and isn't inclusive. So if you happen to be in that room and you're an ally, we need you at that moment to speak up and stand up for the folks who aren't in the room.
Absolutely. And I know you are standing up for many causes, but including one in Orange County. You're volunteering for a charity.
Yeah, the Second Harvest Food Bank. I guess I feel a little bit empowered now that I have the antibodies. A little extra.
But you're out there to help. You're not just sitting at home.
Yes, I'm still in a mask and gloves and I'm in glasses, but yes. I was presented an opportunity to send some videos and, you know, post some, you know, greetings. And I said, well, I want to take it a step further. I want to actually be there. I want to be on the front lines and help and hand out food to folks. And so the past couple of weekends, gone down to Orange County and, you know, put bags of food in in the trunks of some people's cars.
Well, that's great.
And there's a lot of people who are yes, yeah, I've done it with my partner, and but there are a lot of folks who are struggling right now, and you know, we could all use as much help as we can. So this is my way of you know, sort of, you know, being there for my community. And it's so interesting because it's happened at the Honda Center, which used to be called the Anaheim Pond. I think you know that because you're from SoCal originally. Yeah. But I won a state championship in high school there. So it's really cool to look up and see, you know, an arena that, you know, I played in over 20 years ago. But probably close to actually 25 years ago. But anyways, but then to be doing this good work in the shadow of that arena. So yeah.
It's really an incredibly rare moment where as a community we can come together, and as you know, bad the situation might be on a government level or on a policy front, I think, Jason, right now is a very rare and humbling moment where people can come together.
Yeah, and support each other, and again goes back to stepping outside of just yourself kind of thing and realizing that we're all in this together. This is our community, these are our communities, these are, you know, societies. So it really irritates me when I see those videos of people who are complaining about putting on a mask to go grocery shopping. Like, put on the mask to go grocery shopping. This isn't about, like, this isn't about you. And this is about all of us kind of thing.
Well, thank you so much for being an inspiration, being a strong voice, and also, you know, standing up. I think it's incredible for people out there, especially younger people, to look at folks like yourself who recovered and are doing well, but are also kind along the way. Thank you so much, Jason Collins, for joining me on the program. Be well. Enjoy California.
Thank you for having me on. Yes, you too. And I'll keep on exercising, riding this Peloton.
At home, good.
Yes.
Thanks so much, Jason.
Speak soon.
Thank you.
Bye-bye.
Thanks.